Altered Physiology, Mechanisms of Disease 2, Week 1, Episode 2 on the musculoskeletal system. In this particular episode, we will highlight bone remodeling, fractures, skeletal muscle, and aging. So, as I've mentioned, bone is constantly undergoing both formation and resorption. There are three phases to be aware of. You have the activation of the remodeling cycle, you have resorption of bone or breakdown, and then new bone is also formed to replace it. You can see the bone remodeling cycle of normal bone highlighted in the far right of your screen. It is also important to note, though, that there are many factors that regulate bone remodeling. So as I mentioned in the preceding lecture, we have rank L as one example, we have OPG, and as we'll go on to learn, estrogen also plays a role. Now let's turn our attention to one of those most common MSK type injuries, and that in fact would be a fracture. And a fracture refers to a break in the continuity of a bone. And there are many different types of fractures, and the bone can be either completely or incompletely fractured. And we have what are known as closed versus open fractures. A closed fracture leaves the skin intact, an open fracture has an overlying skin wound. And also, the different types of fractures can be named by the direction of the fracture line. So they can be linear, oblique, spiral, or transverse in nature. I would like to highlight three types of fractures. The stress fracture, which occurs in normal or abnormal bone when it is subjected to repeated stress. So for example, stress fractures can commonly occur in athletes, particularly endurance athletes. If you think about a marathon runner, for example, they are performing a very repetitive type of action as they run approximately 42 kilometers. Next, you have a fatigue fracture, and that occurs in normal bone that is subjected to an abnormal stress. So that might be an emergency type or incident that is unexpected, but among an individual who has normal bone mass, for example. And lastly, you have insufficiency or fragility type fractures, and that is when simply normal weight bearing can cause a fracture in an abnormal bone. So that tends to occur in individuals who are frail. Now, more importantly comes the repair process or healing. There are multiple stages of healing. We can have direct and indirect healing as well. Direct healing most often occurs when the surgical fixation is used to repair a broken bone. There is an intramembranous bone formation and no callus is formed. The image on the top right of your screen, in contrast, does show the formation of a callus. Indirect healing is most often observed when a fracture is treated with a cast or a non-surgical method. In this case, intramembranous and endochondral bone formation can occur. Callus formation can occur as well, and it does involve the remodeling of a solid bone. If we look at the diagram on the right of your screen, there are 5 stages of healing from A through E. First, we have at the very top in image A, the formation of a hematoma. This is when you have bleeding present at both ends. In image B, the hematoma then organizes itself into a fibrous network. In figure C, the osteoblast will invade and collagen strands, collagen strands lengthen, and you have calcium deposits. In image D, you can actually see that callus formation occur, and this is where new bone can be built and old bone is essentially destroyed. Lastly, in image E, you have the completion or um, uh, accomplishment of bone remodeling. Excess callus tends to be removed and trabecular bone is deposited. So manifestations of a fracture. Clinically, you may notice an unnatural alignment, the presence of swelling, muscle spasms, tenderness, pain, impaired sensation, or decreased mobility. It can often be associated with numbness if there is nerve trauma. Treatment, as I've mentioned, could involve surgery, so internal and external fixation, but it can also just be something as simple as a cast where you have that particular limb immobilized. Let's move on briefly to talk about skeletal muscle. So this is a very quick review, but as you know, we have millions of individual muscle fibers that contract and relax to facilitate movement. They do have attachments, typically on the bone, and so that is it's again one of the functions of bone that we discussed in the first episode. You can see here the composition of skeletal muscle is quite different than bone, obviously, primarily composed of water. We also have more than 600 skeletal muscles in our body, and there are a variety of shapes and sizes. Now, I did want to highlight how exactly the MSK system is altered with aging. Within our bones, we tend to have bone loss. Our bones are less dense, less strong, and more brittle. The time it takes to remodel bone is lengthened. Now let's speak to alterations in our joints. With aging, cartilage tends to become more rigid, fragile, and susceptible to fraying. We tend to also have a decreased range of motion at the joint. Lastly, if we're considering muscles, with aging, individuals tend to have a decline in muscle strength. And lastly, some additional changes that we see in muscles. The first of which is sarcopenia. So that would be the top line you can fill in there. So sarcopenia does present, and that is the age-related loss in skeletal muscle, and it is a direct cause of a decrease in muscle strength. Individuals can have a slow decline in both dynamic and isometric strength, particularly after the age of 70. Things such as oxygen intake, basal metabolic rate, and lean body mass tend to decline with aging. Regenerative function of muscle tissue actually remains normal. So we do not observe a decline in the regenerative function of muscle tissue. And that concludes this episode.